my presentation will come there, right? Assalamu alaikum, ladies and gentlemen. Today from Pakistan Business Council and from COVID Health Pandemic Health Awareness Program, my name is Dr. Mohammad Farhan. I am Executive Board Member, Pakistan Business Council, and by profession, I'm working as a family medicine physician, as a frontline worker. So today we are just talking about a very good topic after the COVID or post-COVID, that is COVID after post-COVID impact on mental health. We will start the seminar and we invite our Pakistan Business Council Vice President Program, Mr. Iqbal Naseem, to start the topic, and we will join you. Thank you very much for joining.
Thank you, Dr. Mohammad Farhan, for the brief introduction. On behalf of Pakistan Business and Professional Council, Abu Dhabi, and with our President, Dr. Saeed Kasranis, and our board member, membership Vice President, Mr. Dr. Farhan. He organized this seminar at the request of Dr. Hadi Shahid, Dr. Abdul Hadi Shahid. He requested to update every month on health situations. And Dr. Farhan, he took the task and he started this initiative. First, बिस्मिल्लाह करता हूँ अल्लाह के नाम से तिलावत है औज़ुबिल्लाहि मिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम इन्ना आतैनकल कौसर फसल्लि लिरब्बिका वन्हर इन्ना शानिअका हुवल अब्तर सदक़ल्लाहुल अलीयुल अज़ीम अल्लाहुम्मा सल्लि अला सय्यिदिना मुहम्मदिन नबiyyi व आलिहि व सहबिहि व बारिक वसल्लम. On today's panelist, today's topic is very important topic, and it's the impact of COVID-19 on mental health. This after effect, how people will take and how one has to pass through easily on this kind of situations, in fact. And today's in our program, Dr. Saeed Kasranis, our President, Pakistan Business Professional Council, Dr. Mohammad Farhan, he is a family medicine specialist, in informatics physician, and frontline, warrior on this COVID-19. As well as our, Vice President Membership Program, Pakistan Business and Professional Council, as well as Dr. Faisal Arshad also here. He's a specialist family medicine and internal medicine as well. And myself is there, VP Program. So I will hand over to Dr. Faisal Arshad now to go through his presentation on this topic. Over to you, Dr. Farhan, Dr. Faisal.
If it's there, okay. Yeah. Assalamu alaikum, everyone. Good afternoon. I'm Dr. Faisal. I'm working as a family medicine, internal medicine specialist in one of the hospitals in Abu Dhabi. Today I have been invited to have a discussion or a brief presentation on the mental health issues that can impact a person or a community after a pandemic or a disaster situation. Next slide, please. So the presentation today will be depending on, like what assessment we should go through and what intervention we have to take after any disaster or a pandemic condition which affects mass people or a community in general. So the challenges that we have with COVID-19 is we don't know exactly the prognosis, how it's going to behave and what will be the outcome in the future. Plus, there are shortages of services like resources for testing and treatment. The healthcare professionals themselves feels that they are unprotected and they have to do extra precaution because as the treatment is very gloomy in this condition. Plus, the public health measures that have been imposed by the government to counteract the condition, like breaching your personal movements or your interference with the your freedom, that's impact the mental health as well. And the financial loss, on the other hand, when the people have to be confined and not doing their proper jobs and businesses, that's impacting their lives as well. So in the beginning, the conflicting messages from the authority about the disease itself and very rapidly progressing disease affecting the world very fast have bring out increasing risk of psychiatric mental health association illness with the COVID-19. Next slide, please. So is COVID-19 pandemic is a public health emergency? This was a question in our we are facing, that because of large amount of communities involved or the people involved in this uh, pandemic, either by infection or by the restriction itself, it causes a sense of insecurity, confusion, emotional isolation, and the communities itself lose its connection, like not going to schools, work, and the inadequate resources in some part of the world due to this pandemic has caused severe disruption in person ability for having increased stress. Next slide, please. So this emotional disaster that we saw then translate to a range of emotional reactions in the public. It can be a psychiatric condition, uncertain, unhealthy behavior, which can people involved in substance abuse, like more consumption of dependent substance, addictions, alcohols. And because of the non-compliance with the public health directives, the people become more involved in unhealthy practices and that put them on more risk. In people who contracted the disease and in general population, extensive research in public health has established that this causes a severe emotional disaster impact on the effect of personal behaving during its community activities and community responsibilities. Next slide, please. So based on the data has been provided, there are certain group of individuals in the community who are at more risk compared to others in such sort of conditions. These particular peoples include those who have elderly, those who have compromised immune system, those who are having pre-existing medical or psychiatric conditions, and those who have history of previous substance abuse or substance use problem. So the psychological impact of a disaster is usually more on these certain group of people. Next slide, please. So whenever there's a disaster happens, the effect of it trickles according to this diagram. As you can see here, like there is a direct victim who's involved, like the person who's been involved in the infection or person who got deceased because of the infection. The first contact or the first stressors is being transferred to the close relative of that person. So their response could be bereavement or brief psychological disturbance because of the loss. The second problem, it goes to the support providers, like the community support providers, as well as the destruction that happened because of his loss. And this on transmits to the larger effect on the community as well. Next slide, please. So the frontline workers are the first one who got impacted because of the COVID during the pandemic. The healthcare providers have to provide the necessary care to their patients. Plus, at the same time, they have to protect themselves from this disease as well. So the concern of getting infection and not having a concern to transfer this infection to their loved ones, and certain conditions, it happens when there is shortage of personal protective equipment, plus staying away from the family for long hours, have created a significant emotional impact on their lives. And this has caused a series of mental health issues with the healthcare professionals as well, to which they have to be uh, taken care and to get support, as some of the hospitals and institutes have started during this pandemic, brief health, personal health or health hygiene counseling with these psychiatrists and psychologists, so they can be controlled or they can be make sure that they have been protected and they've been taken care and their families are protected so they can perform their jobs excellently. Next slide, please. Next slide, please. So what are the exact challenges of the mental health which happens during the COVID? So the illness itself, as you know, it's a multi-system involvement disease, and there are evidence that it involved the CNS, our brain as well, and the functioning of the brain itself get compromised because of the illness itself. The other psychological issues are the fear of the illness increases, like what will happen if I contracted the disease? There is a possibility that you might die, or people are dying in front of, in close contact to you. There's a sense of grief when you lost a close relative. There is this, and you cannot seek mental health or any issues efficiently because of the restrictions and quarantine and isolation issues. You are socially isolated, and there's disruption of normal activities. Plus, some people and most of the people in other part of the world do have faced financial stresses as well, as loss of job, loss of effective pays, and all these things. So this mental, as all, has challenged our mental system or mental health to an extent, to a level. Next slide, please. So they try to find out what should be an association in mental health illness in US based on the studies, and they have done certain studies comparing COVID with other illnesses and in normal individuals as well, patients who have pre-existing psychiatric illnesses as well, and as a normal person. And they have found out that there is a quite significant increase in the percentage of people who got infected because of COVID, and their have mental health issues have increased. As you can see in the figures, that it should be like around 6%, and it has increased to around 18%, which is a quite significant rise. And disorders like anxiety, stress, insomnia, early onset of dementia in elder people, episodes of depression and suicide have increased in society because of the COVID itself. Next slide, please. So now, as we have come across the complications or the impact on mental health because of the COVID, what acute interventions or we can take to prevent such a spread, or to what have damage have been done, how to control that as well. Opportunity to monitor psychological needs and to deliver support during the direct patient encounter in clinical practice are generally curtailed in this crisis for a large scale because of home confinement. A very important part of our medical services is that there is patient to doctor contact, in which a doctor can identify his client or his patient has suffered any mental issues because of any other stresses in the life. But in COVID, the things are different, that there is a distance between the two. Like a doctor cannot see his patient very efficiently because of the restriction and isolation issues. So psychological services are really not being provided in the primary healthcare setting as it should be. Some facilities, as we know, even the government facilities, Saha has started telemedicine, and the Abu Dhabi government has given permission on acute basis all over the world as well to have telemedicine consultations. This has improved some extent of the contact loss between the patient and the doctor, and because of that, some you can say some control can be achieved by a telemedicine. The next step, please. So what psychological first aid can be provided during our brief consultation with the patient to reduce their stress levels to reduce the traumatic effect, what they're going through. And the psychological first aid is designed to reduce the initial distress caused by the traumatic event and to foster the short-term and the long-term adaptive functioning and coping. Next slide, please. So the components of the psychological first aid, or the first initial steps that can be done in a primary healthcare or first visit with you, is to provide basic needs, to protect from further harm, to reduce the agitation and arousals, and to support those who are most distressed. Keep the families together, support the psychological support or the social support should be there, and to provide information through faster communication and education. This is very important that the webinars or the stuff, even which the Pakistan community or the Business Council have initiated under Dr. Farhan, is also very efficient in the way that the first-hand knowledge from the front line and other groups have been provided to the community itself, that the panic situation should not be, that much level of stress should not be created by that. And the orientation of available services and resources, which is being provided through different websites all over the world, plus in Abu Dhabi very efficiently, that how you can get the test done, where are the quarantine facilities, the messages, Al Husn app itself, very efficiently is being done for psychological support in the initial phase or the acute phase. And this has shown results as well. Next slide, please. The one important aspects that we should be looking at in our clinic settings or in patient-doctor interaction is to evaluate the suicidal risk in the person who's been under severe mental distress. In light of widening economic crisis and numerous uncertainties surrounding this pandemic, suicidal ideation may emerge and necessitate immediate consultation for a medical health professional and referrals to emergency psychiatric hospitalization and as well as consultation. Next slide, please. Suicidal thinking can be evaluated with I think, I don't know my audience is having some medical background or no. These are certain, questions that should be asked during our consultation to assess the person in distress. What is his level of, is he thinking like that? Is he harmful thinking for himself or to harm to others? And for how long he's been having these, and what is his plan? Has he executed any plan to commit suicide or not? Next slide, please. So this slide is the assessment ladder, as I've discussed, that how we can go about asking in different ways to our patients that what is their thinking about life, how they're enjoying their life or no, what are their thoughts about dying, what are thoughts about injuring themselves, what are their thoughts about injuring to others. So these simple questions can give us some assessment on the patient, how he is feeling from inside and what is the level of stress. Based on that, we can plan our referrals. If somebody has a suicidal ideation or have a written plan, for example, how he will execute this, it is very important to refer these type of people early to psychiatric help so they can be taken care as well. Next slide, please. So the role of pharmacotherapy in acute stress disorders or in acute stress condition, as we have said that this pandemic has evolved as an acute mental health crisis. So the role of certain medicine in terms of benzodiazepine, hypnotic medicines, and antipsychotic medicine, although the research is not that supportive of using, but these medicine, when are used in short-term courses under supervision, have proven some benefits for the patient. Next slide, please. After the primary intervention that as we have taken to reduce or to assess, what we can do is those who have been identified as having a high risk of mental distress or disorder, during our primary healthcare consultation, we can manage them in our clinics based on certain, if we have the facility of a psychotherapist, a brief cognitive and exposure-based psychotherapies have proven to have better output than supportive and non. offered, as you know, on monthly basis and on teleconsultation as well. And the duration can be up to a month for this. It has shown that it has reduced the incidence of a term which is written here, post-traumatic stress disorders. Usually when there is a, affective trauma, so then there is a stress after that trauma, and that can cause a prolonged effect on the patient's life, and this can be reduced with these type of therapies. Next slide, please. So another important step or a point in building up the mental health is building up of resilience. Resilience is how you recover back from an impact of a disease that has been, or any disaster or anything which has made you fall to a ground, and how you pick up from there and become functional again to the same level of effectiveness. So this can be built by realistic optimism, giving courage to face the fear. There is moral compass, there is religion and spirituality through this, social support, and having resilience role model, giving examples of the community or people or group of people who have come out of these situations with their example, becoming yourself as physically and fit, that gives you a mental fitness as well, and some cognitive and emotional stability we can provide through our consultation. This will meet the purpose of building up a resilience or a resilient community that can effectively fight any disaster or a public health condition. Next slide, please. So these are the 5 elements of intervention. As you see, the term used is mass trauma intervention, because before COVID, most of the studies or in public health, the work which has been done is after disasters, or disasters that are in terms of earthquake, war, or all these things, and what people come up how to build up a community or a public health well-being of a community is through these 5 principles, which is to promote a sense of safety and promote calm in the situation in the community, promote sense of self and collective efficacy, promote like everybody is in contact and with supporting each other and promoting hope. Next slide, please. So the take-home message from my today's presentation would be that the range of risk and resilience factors shape in the mental health impact of mass disaster event. There are ranges of risk and resilience factors. The majority of our post-COVID mental treatment interventions relies on early identification and proper resource utilization and allocation to the community or a person who has most need. Acute, post-traumatic, and disaster mental health intervention for COVID are largely supportive, building trust, resilience, short-term use of pharmacological agents for the symptom reduction, and the selective use of brief cognitive-based psychotherapy. The long-term effects of this disaster in mental health intervention in COVID is mostly drawn from the standard approach, such as the problem, excuse me, that arises 5% to, you can say 3 to 5% of the people who will develop major depression or substance abuse, suicidal ideation, and suicidal tendencies has to be properly identified and referred to psychiatric services. Thank you very much. I think I can give the floor to Dr. Farhan now for the further continuation, and then we can take some question in the end as well.
Thank you, Dr. Faisal. It's a very informative presentation you made. Impact of COVID-19, mental health. Each and every subject you covered. In fact, very minute one to the big one. All was covered. And from here we will go through a presentation or a few words from Dr. Farhan. He is our Vice President membership as well as frontline warrior on COVID-19 situation. Dr. Farhan, over to you. Thank you, Dr. Faisal.
Thank you, sir. Thank you very much.
Assalamu alaikum. Thank you, Dr. Faisal Arshad. He always been with me. Whenever I ask him to give the valuable information, he's always there. He's brother to me, and he actually worked in a very prime COVID centers in emergencies when the pandemic is on high alert, and he worked so efficiently. And I always used to connect with him, and we discussed the cases. And Alhamdulillah, for today, more than our expectations, he explained everything in detail. And much for me, not left actually, but yes, I will continue his presentation, and I will give some remarks on the presentation that actually COVID-19 on mental health impact after the post-COVID, we have to understand the others, we have to help others, we have to connect others, and the basic treatment is not actually basically medically. Medical treatment start when the impact of COVID-19 on mental health already happened. Today, I want to talk more about how to prevent others to go to depression or mental illness before or after COVID illness. How we work as a community, how we work as an individual, and how we work as a healthcare workers to others. Impact of COVID-19, basically, I want to give some introduction of COVID-19, what had happened, how we start, how the pandemic start, how this internationally a pandemic in health emergency declared by WHO. Basically, I will give some introduction, which you already aware, but it is important for me to explain how we were before in COVID-19 and how we handle this situation, and the things will be better with time. Introduction, next slide, please. See, for our aim was the agenda for today for this introduction of COVID-19, then statistics of COVID-19, then children and teens at risk before COVID-19, during COVID-19, and after post-COVID, what are the symptoms and child and teens at risk? How can our parents or the small children parents help in COVID-19? Then elderly and people with disability or people of determination, how we help them in COVID-19. Stress, what is stress and how we relieve stress. Then self-care body measure of your body. First, always help yourself, and then you are ready to help others. Then self-care of your mind and your family mind and your community mind, and self-care connect with others, and the conclusion. Next slide. See, the COVID-19 started, as you know, in December, I think 2019. From the end of December, we found first case in China, Wuhan. And after that, slightly, we don't know what will happen, but from the December and start of January 2020, they found some cases and during the international traveling, and we found that some of the virus arises. And after January ends to February 2020, the mass cases arises in the whole world, and whole healthcare emergencies or healthcare organization alert that this is something which is new and we have to take care of it. COVID-19 in February 2020, I remembered, as declared as a pandemic all over the world by WHO and CDC clinical disease, communicable disease website. After that, the whole world activated the pandemic, and we gave the name virus COVID-19. We don't know what is this virus at that time. We want to help others and help people to save it, but immediately within few weeks, this virus spread most of the countries with a large number of cases. Initially, the symptoms comes like fever, nose running, loss of sense of smell, mild symptom of flu, fever, sore throat. But drastically, what the old age people who are high risk and the middle age people who have chronic condition, this disease has been proven very disastrous. And this disaster went to end up when ICUs full, hospitalization full everywhere. There is, as Dr. Faisal has mentioned, there is a utilities, hospital utilities were not prepared according to the mass illness. So we have a shortage of doctor, we have shortage of knowledge, we have shortage of hospital consumables. But as a healthcare in every country, I must say, and especially for a government of Abu Dhabi and government of UAE immediately took the immediate emergency actions to take care of the community. and immediately WHO gave us the rules for we have to less traveling, social distancing, mask on, how to prevent the disease further, and hand washing, mask on, and these are the conditions. Then we implement immediately with the public awareness. Then slowly this virus went up and the death rates increased. So at that moment when the virus comes to the public and community, so the mental part already giving the stress to the people, individual, by the family or by the community. So at that time we see mostly to cure the virus, and we didn't look much to the mental illness after the COVID impact. But slowly I think in the August 2020, the most of the researchers in the whole world, including UAE, including all area of healthcare researchers, try to make the vaccine to help others and prevent this disease. So from July to August, we got a good news in 2020. Then the vaccination trial started with many countries started, like UK, US, China, and UAE too started. UAE in the first major Gulf country who started the take step and started the vaccination trial of Sinopharm. And after that, the Sinopharm trial succeeded, and we start to give community with a clinical trial. And after the clinical trial and the health authorities in the whole world approval, the mass vaccination started. At that time, slowly we got information about the treatment and information about the pathway of the disease. So we try to work together to get vaccinated, and I was very happy at that time that the virus slide of the peak is going down, and we are trying. A hope actually came to save others and save our family and save the world. One thing I must say, the public awareness is very important in this era, and in this country, UAE took active actions like health authorities make the prevention steps, and for the tents, they made it for the PCR COVID immediately. They make the IT organization come up, and they said, just continue the work with IT like Zooms, webinars, health awareness. And at that time, Pakistan Business Council took action with Pakistan Embassy, Abu Dhabi and UAE. They just came up with different public awareness idea. And I must say, in this COVID, our president, Dr. Kaisar Anis, has came up with a different, very valuable ideas to start the webinars on different topics like economy, like for health of the community. For health webinars, we started the health desk. And our VP program, Mr. Naseem Iqbal, I must thank, with our founding members, Zafar Iqbal and Dr. Hadi Shahid, very interactive. We had a meeting how to give the good message to the public, to give the positive thinking and help others. After that, vaccination drive came up, and after that, we see the surge of the virus comes up and down. But when the 2021 started, we started the 25 to 30% vaccination in the community. Slowly, the things going up, but we has got more losses of the chronic condition people and elderly, same to same. But our morale was up, and at that time, the virus comes and goes, and we go forward. For COVID-19, elderly people and disability, and how to handle the health stress and self-care. This is actually slightly intro till now COVID. At the moment for today, COVID-19, the good things are the cases are low, the severity are low due to the herd immunity, due to vaccinations, due to the public awareness, due to the preventive action taken by government of Abu Dhabi, WHO for the whole world. And of course, the public understand, the public awareness are up to date that what has to be done and what will happen. So nowadays, we are in a good era of COVID-19 to slow down, but we continue our efforts for just following up the health awareness program like mask on, social distancing, get vaccination. And yes, if sometimes the virus comes, then you have to take the treatment. And that's the time, the frontline worker, you have to connect with your doctors, with your family, with your health. But isolation is very important. Everybody who has a fever or flu, either isolate yourself to help others, because we have to block the break chain. If one virus has got with one person and he will go with other, and he will meet and he will transmit. So the blockchain is very important. So if you please think about your responsibility at the time you have fever, nose running or flu symptom, isolate, mask on, do the PCR. After that, if the PCR comes positive, repeat the PCR within 24 hours and see if this is false negative or false positive or this is true positive. Then you 2 to 3 days, 4 days, you repeat the PCR, and if 2 PCRs negative, you come up and mix with the community again. These are the small things. Now we comes, because Dr. Faisal already gave a vast introduction and explanation of the mental stress. Now I will come to the children and teen at risk. See, children, teens at risk after the COVID or during the COVID, because we are not allowed to meet the children who has got COVID. But yes, one family member, what I understand is either father or mother has to understand, cool, calm. The parents has to cool, calm during the COVID in the children, because don't escape them, just to tell them the children at home should isolate, but in their room, they should be calm and continue their daily life activities. This is very important. Maybe your child will be more excessive crying, annoying behavior, sadness. They are not eating well. They are crying all the time. They are not eating well. And they have multiple symptoms like headache, like cough, like nose running. Don't worry. Just explain your children, be calm, continue their daily life in the room, in an isolated room where the hygiene is important, where they both, the father, mother, if meet with the children, the social distancing is important, mask on. The children who has got COVID, wash hands, give him the good food, exercises, just they pray in the room. After that, they meet by IT, WhatsApp, by bottom, by Facebook, by social media, just interact with their family either inside the UAE or outside the UAE. So they will be connect with their family, so they will not feel alone. COVID is, according to me, the fight is with yourself and with your mental health and your positive thinking. And if, believe me, you are positive, you can defeat this COVID easily. Yes, if the symptoms comes up, that suppose the fever is more than 100, oxygen saturation level goes down less than 94, you have cough, you are feeling not well, then immediately you have to contact teleconsultation with your primary healthcare physician, take help. But before the help, you should be positive that you will defeat you can fight with the COVID-19 very well. Of course, a good health and good eating means eat healthy fruits, vegetable, lots of fluids, lots of fruits, vegetable juices, soup, hot drinks, lots of water. And these are the things added with a good health, multivitamins like vitamin C and vitamin D and multivitamin and zinc. You have to eat a lot. Continue monitor your symptoms at home. And during the COVID-19 in the room, please advise elderly or children to continue your life. Don't cut them out from social community. Just connect with IT and social media so they can spend time. They can sleep 8 to 9 hours as a routinely. They can do exercise inside the room. They can do things which are positive thoughts like games. They can do it. They can pray. They can connect with the friends through social media. They can connect with their families. So these kind of thing reduces their thinking towards depression, towards negativity. And once the negative thinkings comes, they multiply in few weeks and the children is irritated and the impact is going on. And then the child psychologist or a child psychiatrist should continue to, and the family, they pull them back towards positive thinking, and we will defeat this COVID. Important thing, don't isolate yourself in the room to prevent the spread, but don't isolate the mind. Our mind should be connect with the family, with friends, with the social activities, and with health activities, and with pray in the room and continue your life, sleep. Most of the children are not sleeping properly, so they have headaches in the morning, and 8 hours sleep is important on time. Next slide, please. Elderly and people with disability. in every home there must be kids, there must be elderly people. If elderly people are more risk and more higher risk than a children on mental health, because they already have are very old with a chronic disease, they are fighting with multiple chronic disease, diseases like blood pressure, like hypertension, like joint diseases, like heart diseases, like kidney diseases, like diabetes. So they already have been, but the impact of the COVID increased the risk factors of the already chronic diseases with lungs pneumonia, and most of the people have scared to go to ICU. So we have to take care of our elderly very efficiently during the COVID. Once any family member is become the COVID positive, away from the elderly people, isolate yourself to just prevent them got infected, but be connected with social media. And yes, if they have a symptom that they got the COVID and they got the symptoms and they got into depression, so they will not talk to you properly. They have the shouting and irritating behavior. They stopped eating. They became quiet. They don't want to meet people. So it's our duty and family and community duty to contact with them. Don't mind about what they are talking. Just get help with the psychiatrist, with the psychologist. But family support is very important. Treat the disease, treat the cause, but don't isolate socially these higher risk people. Family member has a very good impact and very good role to pull them out from COVID or depression. And then medication, as Dr. Faisal has advised, that after the symptom you think is more than control, we can talk to them and we can get health or medical help to them. Self-care body. Self-care body is very important, because if in an airline, always they say once you get emergency while during the flight, you have to help yourself first and then help others. This is the basic technique everywhere in the world. So first, wherever you are, you have to get healthy first, and how you take care of your body and your mind. So of course, I said you have to do regular exercises, regular get sleep, regular take good eating habits, healthy exercising, praying, avoid please dependency things like drugs, alcohol, tobacco, limit the screen time on the mobile, link with your family, link with your people, and connect and help others. Relax, and the practice that if you have anxiety or something, my strategy always is there to get connected with the people and help others. If you help others, so you will get help by everybody in a community. Self-care, connect with others. This is a very important subject of COVID-19 on mental health, that please connect with others. And I learned this one from my seniors. They always think once you see the COVID positive patient, I have already the precautionary measures, my protecting personal equipments. I have the mask, I have double mask, I have face shield, I have gloves, I have a plastic suit, everything. But normally my seniors, they used to give the cool and calm appearance of the COVID patient. Give them we are here to cure you. Don't be scared with COVID patient, because after this is the best thing I can advise to my family physicians also. Yes, make the distance, do the follow-up protocol, follow it, but give them the proper cure hand to them, that they are with us and they isolate for a few days and we will live together. The connection socially is very important. Public awareness is very important. And believe me, if you do something to others and help others, you satisfy like anything. And always Allah will help you and Allah will give you rewards on that, which you will not expect. Support to a family friend or a family member by in any means. Suppose your friend have some economic impact in the COVID-19, whatever you can do, you can communicate and you can help him. Just talk to them. If they have a food problem, they have economy problem, they have the job problem, they have the health problem, always be there for them. So when you will be in trouble, so the whole community which you already helped, they will come forward to you. So this is my today message. Believe me, we are in a good condition now. We passed a bad time. Now we are waiting for good time for the COVID. But one thing, remember, continue SOPs, continue, because COVID not yet finished. Get vaccinated, follow SOPs, be safety, and connect with the people. Take care of yourself and take care of others. Always give you reward. I must thank our president, Dr. Kaisar Anis, Pakistan Embassy, Abu Dhabi, and Mr. Imtiaz Gondal Saab. Yesterday I spoke. They gave us a full support to fight and help COVID-19. I was already involved in give much awareness strength for Pakistan Embassy, and they already give the every week they give the public awareness Facebook messages. Pakistan Business Council, Dr. Kaisar Anis, Dr. Hadi Shahid always supported us, advised us, and guided us very well. Thank you very much. And we end up this health webinar every month. We will come up with the new things. If you have any ideas and topics of the health webinar on Pakistan Business Professional Council, me and Dr. Kaisar Anis and Mr. Iqbal Naseem always there. See you next month. Assalamu alaikum. Hand over to Mr. Naseem.
Thank you very much, Dr. Farhan. Very informative session you conducted, and all the topics you touched, and that's a real way. It is happening in every house, in every home, irrespective of the gender, age, or any sector or anything. But really, it's very informative, and thank you very much. Is there any question? So we will answer you on this same Facebook or in.
Yes, this will be available in YouTube, Facebook. You can ask us, Pakistan Business Council platform. Please continue our health update and health desk, and any question you can write it and we will get back to you. So I think we can close.
Yeah.
Thank you very much.
Thanks.
Assalamu alaikum.
Walaikum salam.